Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Lowyball, and this week we are talking about a relatively common autoimmune disease. Sjögren's disease is when the immune system chases its own tail. Kittens are fascinatingly weird creatures. They sleep, jump, hunt ghosts, and are some of the cutest little things in the world. They also occasionally chase their own tail. Some cats catch their tail, bite it, and enter a feedback loop in which they feel pain and bite harder in response. This is similar to autoimmune disease, where the immune system mistakenly attacks the body's own cells, senses dying cells as threats, and sends in more immune cells to investigate, worsening the situation. Sjögren's disease, also called Sjögren's syndrome, is a chronic systemic autoimmune disease that causes dry eye, dry mouth, fatigue, and joint pain. Exact numbers are difficult to chase down because different classification criteria are used, but Sjögren's is relatively common for an autoimmune disease, with about 3 to 5 new cases per 100,000 people per year. Onset of Sjögren's disease usually occurs in a person's 30s to 40s and is 9 to 20 times more common in women than men. Sjögren's can manifest on its own, called primary Sjögren's, or be the result of another autoimmune disease like lupus or rheumatoid arthritis, called secondary Sjögren's. Around 80% of those with Sjögren's disease experience the symptoms mentioned above: dry eye, dry mouth, fatigue, and joint pain. For another 30 to 40% of patients, the disease scratches below the surface and affects the whole body in a process called systemic disease. Systemic problems can affect multiple organs and organ systems, including the kidneys, blood vessels, and nervous system. Additionally, those with Sjögren's disease are at a 15 to 20 times increased risk of developing B-cell non-Hodgkin's lymphoma, a type of blood cancer. The basic problem with Sjögren's is that immune cells attack the salivary gland cells near the eyes and mouth. Salivary gland cells produce tears and saliva, which explains the dry eye and dry mouth, but how is Sjögren's disease similar to a tail-chasing kitten? The kitten needs 3 essential elements for its tail shenanigans. Genetic risks. Orange and calico cats have the highest chance of being dumb as bricks. Environmental risks. Parasites, skin irritation, or even just a wiggling tail. And a feedback loop. Every time the cat gets close enough, the tail moves just out of reach. The development of Sjögren's disease needs the same 3 elements: genetic risks, environmental triggers, and a feedback loop. For those with Sjögren's disease, genetic risks increase the immune system's sensitivity and prime it for disruption. In general, this means the genes that control the immune system's activation pathways make it more likely that immune B cells, T cells, and/or interferons attack things that are not dangerous, kind of like a wiggly tail. Environmental triggers are hard to pounce down on, but may include viruses, chemicals, and female sex hormones. These triggers activate the gland cells, prompting them to release chemicals that signal danger and start an inflammatory response. Immune system white blood cells, including T cells and B cells, detect these chemical signals and rush into the gland cells. This starts the feedback loop. The immune cells cause damaging inflammation and release enormous amounts of dangerous proteins called autoantibodies that target the salivary gland cells, damaging or destroying them. As the gland cells become damaged, they release additional danger signals, and the process continues, chasing that tail over and over. In addition, the massive amounts of autoantibodies can spill over into the rest of the body, causing the systemic problems mentioned above. The constant activation of B immune cells is thought to be the reason for the increased chance of B-cell non-Hodgkin's lymphoma. Kittens grow up and usually grow out of chasing their own tail, but the outlook hasn't been so rosy for those with Sjögren's disease. There are currently no FDA-approved disease-modifying medications for Sjögren's disease. Many sufferers use over-the-counter or prescription treatments like pilocarpine eye drops or oral solutions to provide relief from their symptoms. Luckily, the cat's out of the bag, and there are several clinical trials investigating disease-modifying treatments for Sjögren's disease, things that can stop the disease from progressing. These trials target the immune system itself or specific parts of it to try to slow damage to the salivary gland cells, limit white blood cell responses, or lower the number of autoantibodies produced by immune cells. With the help of researchers and volunteers, those with Sjögren's disease may be able to stop chasing their tail and lie down for a well-deserved cat nap. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com. MedEvidence provides evidence-based information that empowers individuals to make informed health decisions. We present unbiased clinical research in clear, accessible formats guided by medical experts and provide education for patients and healthcare professionals with a focus on research as a care option. Note that the information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you're experiencing any medical issue or have any medical concerns, you should consult a doctor or other medical professional. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll talk to you next week.